My mobile number is 9820878022 in case if anybody wants to contact for any inquiries. Stop the discomfort of gas in your stomach. The most obvious thing to do if you want to stop the discomfort of gas in your stomach is to eat slowly. Eating quickly causes you to swallow air, and that can lead to the formation of gas in your gut. Secondly, you should avoid eating foods that cause gas in the first place. These foods can be gluten, dairy, or lactose intolerant. So, I'll start with speaking about lactose intolerance. The fermentation of lactose in the colon produces gas and short chain fatty acids. These acids are absorbed by the body and produce stomach pain. The pain usually occurs in the lower abdomen and around the navel. The, this can also lead to diarrhea. The fermentation process also increases water in the colon, resulting in a larger volume of stools. To test for lactose intolerance, a doctor will ask about the symptoms and dietary history. They might also perform a breath test to measure the amount of hydrogen in the breath. Lactose breaks down the different gases in the colon, including hydrogen. The test involves blowing into a tube every half hour after you eat lactose. If the level increases, the patient likely has lactose intolerance. Usually, lactose intolerance can be diagnosed by a hydrogen breath test, which can be done at a doctor's clinic or at a hospital. The doctor will insert a long tube through the mouth and take tissue samples for analysis. The samples will be sent to a lab for further analysis. In the meantime, a person with lactose intolerance will need to limit the amount of milk or dairy in the diet. They can also eat foods that contain less lactose, such as yogurt, cheese. Some people can also substitute non-dairy products, such as non-dairy creamer. There are a few other conditions that can cause lactose intolerance. In rare cases, a person may have a small intestine with insufficient amount of lactose. For example, babies who are premature may not produce enough lactose after birth. The type of intolerance will typically improve with treatment of the underlying disorder. Many people with lactose intolerance experience gas in the stomach as a result of a lack of lactose enzymes in the body. When lactose is not digested in the small intestine, it passes in the colon where bacteria break down into fatty acids and gases. These gases produce metabolites, pass through the body, causing the gas and bloating in some cases. It may be possible to cure lactose intolerance by avoiding dairy products and taking lactose enzyme supplements. If you're concerned that you may be lactose intolerant, it is best to try different dairy products in small quantities first. Then gradually add more dairy products to your diet until you are able to tolerate them without experiencing the uncomfortable side effects. If you are able to tolerate half a cup of milk with your meals, it's a good start. When you're able to tolerate these dairy need foods, you'll be able to enjoy the calcium and other nutrients they provide. Lactose intolerance can be sudden or ongoing if you are a regular consumer of dairy products. You may not experience symptoms until you reach adulthood. Fortunately, this condition usually resolves itself over time. Gluten intolerance. Gluten is a protein found in many foods. People who are sensitive to it may experience a range of uncomfortable and sometimes painful symptoms. This can have serious long-term health effects. For some, it can even lead to celiac disease. Others may experience symptoms related to non-celiac gluten intolerance. Fortunately, there is a gluten-free diet that can help improve your symptoms. Gas in the symptoms. Gas in the stomach is a common symptom of gluten intolerance. Rather than feeling full and flat, the stomach feels bloated and painful. You may also have alternating diarrhea and constipation. Regardless of your reason for experiencing bloating, you should seek medical attention if you notice that your stomach is constantly filled with gas. Gluten intolerance can also lead to other digestive problems. In severe cases, the condition can lead to celiac disease, An autoimmune disease, in this case, the body's immune system attacks the small intestine, reducing its ability to absorb nutrients. If you suspect you may have gluten intolerance, you should consult a gastroenterologist. Other symptoms of gluten intolerance include headaches, brain fog. Though these are not sure signs of gluten intolerance, they often occur in conjugation with other symptoms. It is also possible to experience rashes, dry skin. Eczema and psoriasis may also be related to gluten intolerance. While the exact cause of gluten intolerance is unknown, researchers have concluded that an imbalance of gut microbes may predispose someone to this condition. It is estimated that approximately 1% of the population has gluten intolerance or gluten allergy. Around 12% of people with this condition experience stomach discomfort after eating wheat-based foods. People with the disease must avoid eating wheat, barley, and rye, as they are intolerant to the protein. However, they can eat other foods of the same food group. Those with gluten intolerance may experience cross-reaction symptoms to other foods such as dairy. Dairy. If you suspect you have gluten intolerance, your primary care provider can perform a blood test to confirm your diagnosis. He or she will recommend a gluten-free diet to help you get rid of the symptoms. If you don't have the symptoms of celiac disease, you can try a gluten-free diet for a month. Those with a gluten intolerance may experience bloating symptoms in the stomach when eating gluten-free foods. This can be due to the lack of nutrients in the body, including zinc and potassium. The deficiencies can disrupt the power functioning of digestive enzymes, resulting in bloating and gas. Symptoms of gluten intolerance vary but can affect almost anyone. Gluten intolerance can be difficult to diagnose. The good news is that the symptoms are treatable and often only require a change of lifestyle. The dairy intolerance. Dairy intolerance is a common digestive disorder where the body cannot properly digest lactose, the sugar found in milk and dairy products. Undigested lactose is fermented by the large intestine by bacteria. This leads to gas and water buildup. These symptoms are common among both adults and children. Thankfully, they are usually mild and treatable. Some people don't even experience early symptoms at all. People with lactose intolerance have an adequate amount of an enzyme in the small intestine called lactase. This enzyme is important for breaking down lactose and allowing the body to absorb glucose and galactose. If the enzyme doesn't function properly, the lactose remains undigested in the large intestine, resulting in uncomfortable symptoms. People with lactose intolerance experience bloating and gas in the stomach. They also experience discomfort when eating foods high in lactose. These symptoms are a symptom of lactose intolerance, a condition that can lead to dehydration. Thankfully, there are solutions for lactose intolerance. By reducing the amount of dairy in the diet, you can reduce or eliminate your symptoms. Symptoms can be uncomfortable, but don't let them keep you from eating your favorite dairy products or dairy foods. You can start slowly adding small amounts of milk to your diet and see how your body responds. In the meantime, you can switch to lower lactose dairy products like low fat yogurt and low fat cheese. You should also consider increasing your intake of vitamin D, an important nutrient for healthy bones and teeth. Vitamin D is found in fortified milk and other dairy products such as eggs, yogurt. The sun is a good source of vitamin D, but many adults lack this vital vitamin. Your primary care physician can prescribe vitamin D and calcium supplements for you. You should also consult with a gastroenterologist if you suspect that you are suffering from lactose intolerance. Thankfully, most people can tolerate small amount of lactose in food. The average glass of milk contains between 8 to 10 grams of lactose. Other dairy products contain very little or no lactose, so you may not experience symptoms. If you think you have a dairy intolerance, it's a good idea to keep a food dairy. If you are concerned, you can also take a lactase enzyme supplement. This will help your body break down the lactose sugar in dairy products. It will prevent gas and cramps. your lactose levels decrease. As a result, symptoms of lactose intolerance may not become apparent until later in life. However, it's important to note that both short-term and chronic terms of forms of intolerance can develop in both cases. Symptoms usually pass within a few days. If you are suffering from lactose intolerance, you can try uh, eating and alternative dairy products. Most of these products are fortified with vitamin D and calcium to help you cope with the symptoms of the condition. While there is no cure for lactose intolerance, you can control the symptoms by cutting down the dairy products in the diet. If you're genetically predisposed, you'll probably never be able to fully rid yourself of this problem. Still, many people find relief when eliminating dairy products from the diet. Thank you. This was it from Dr. Mehta Ira Pinaik about stomach, trying to explain intolerance. If you have any